Hi, so today we're going to talk about some do's and don'ts before and after the laser hair reduction. So, what are the things generally you should not do or avoid? First, importantly, is if you have any sort of infection, like you have a mild sunburn, or you're having an infection, bacterial infection, or a viral infection like herpes, a fulminant acne, at that point of time for about 2 to 3 weeks you can avoid doing any sort of procedures, as obviously would have been advised by your dermatologist. The second most important thing is, please do not pluck or wax or thread your face before going in for a laser hair reduction, because you're removing the hair completely off its root. So when the laser beam comes and falls on your skin, there is no pigment for it to basically dissipate on. So there has to be pigment on the hair root for the laser to act on. So please do not use anything which removes the hair root completely, like I said, plucking or waxing or anything of that sort. Then the third important thing is, please do not get yourselves exposed a lot to the sun, at least 3 or 4 days prior to the procedure, and have a lot of sunburn or any sort of phototoxic reaction on your face. These are general things before a hair removal. Now, after or the hair removal. So what generally we tell patients is, once the hair removal is done, during the procedure we will generally shave, or we can tell the patient to shave a few hours before coming in for the procedure. Now why we do this is, the hair follicle is still there in the hair in the root. Up to 1 centimeter or 1.5 centimeter is okay. So the laser beam goes and it basically dissipates what is called as melanin in the hair root. Okay, so that is important. If there is no pigment or melanin, then the laser beam has nothing for it to work on and completely dissipate, or just this process called as photothermolysis cannot happen. So don't do all those things I said earlier. Second thing is, this laser doesn't work for white hair. So when if you have white hair and you think that it is going to go away with the laser hair reduction, it does not work, because only in the hair which has pigment the laser beam can act. Then the third important thing is, why we tell the patient is not to have anything on the skin surface is because if the hair root is intact, it can also, the laser gets absorbed onto the skin where there is pigment and cause a small thermal injury which can form a blister. So that again we do not want. So get it done from a technician who correctly, under the guidance of a dermatologist, knows exactly where to hit the laser beam on, or where exactly and how much to do for each patient. Then the third important aspect is, after the hair removal, you need to advise the patients not to have any hot saunas or not to have any hot showers, and not to use an exfoliative cream or a scrub or a mask for the next 24 to 48 hours. Is very important. And use a mild antibacterial and a combination cream of steroid if in case you have a lot of inflammation over the areas which have been done. Then you're good to go for 2 to 3 weeks before your next session. Thank you.